Welcome to my video. I would like to talk about the benefits of electromedicine. This is the electromedicine device that I use to get rid of chronic fatigue syndrome. There's basically two types of chronic fatigue syndrome, that which is caused by toxins and that which is caused by virus. This is the name of it that comes from your myalgic encephalomyelitis. But in the States we just call it chronic fatigue syndrome. Back when I had it, most doctors had never even heard of it, and there was no real known cure, and there still really isn't any known cure. And I happened across information about how to apply very, very minute amounts of electricity to the blood by use of external electrodes, and that's what I did to get rid of the virus. By external electrodes, I mean these little cloth electrodes held in place by elastic straps. And the current flows in the arteries here. It goes above the heart. It doesn't go into the heart. It goes above the heart. And within 20 minutes, all the blood will pass by that circuit and be affected. So I went from a life of always tired, always feeling a little bit of fever, to back to normalcy. I was about 36 when I got rid of the chronic fatigue syndrome. And within, by the time I was 46, I was racing motocross and beating 20-year-olds in Paraguay. And even today, I still use it, and people are very surprised when I tell them how old I am. So, to give you a little bit of history about electromedicine, way back then, it was very common to have electromedicine devices in the doctor's offices, and they taught it in the medical schools. And this website right here, thebacon.org, has pictures of a lot of the old devices. Like this one right here, medical coil, 1905 to 1911. So what happened is that when they invented antibiotics, Rockefeller wanted to make a lot of money on it, so he made a deal with the government under the table, and the government threatened all the medical schools that if you don't stop teaching electromedicine, you're going to lose your government approval. So they stopped, and the doctors were influenced, of course, to go with the new medicine, to the detriment of the public, because you can kill viruses and bacteria cleanly with electricity, whereas when you use drugs, it's a very toxic therapy. And that's why about 70% of all people now have candida infections in their intestines as a result of killing the good bacteria by taking antibiotics. So the comeback of electromedicine was the resurgence of knowledge about the Rife's frequency device, and the announcement at the first International Symposium on Combination Age Therapies by two New York researchers back in 1991, and they reported that small amounts of electric current were able to disable AIDS virus and test tubes by 95%. And they made a medical patent, and later on, Bob Beck came up with his own method of applying electricity from the outside without any surgery or any implants of any devices. And that's when the blood electrification movement started. So, yeah, I went from being very sick to normal. Well, and more than normal. Motocross is a very physically demanding sport. And I was at a very amateur level racing. But still, to be able to do that at 46, it's really saying something. This is my picture when I got second place at one race. And that's me at a young 46. So, yeah, I highly recommend it. Yeah, so blood electrification does no harm to the blood cells at all. I had my blood examined after 2 months of treatment, and the person examining my blood under the microscope asked me what I was doing, and I said, why? And he said, because your blood is almost perfect. He says, I want to take a picture of your blood and make a poster out of it so I can show people what their blood should look like. So that was my confirmation that the blood electrification does not do anything bad to the blood, and it relieved me of the virus, and I highly recommend it. So basically, 3 things is what it does. It stops infectivity of virus, kills bacteria and fungus in your blood, and it breaks up blood cell clumping. The very smallest veins in your body are called capillaries, and they are so thin or so small that they accept 1 blood cell at a time. Okay, but very common nowadays is what's called rouleau, and that's the blood cells clumping together in long chains, which is what you see right here. And when it does that, they cannot enter into the capillaries. And so you basically, even though you're eating good, you're getting exercise, the nutrition's there, the oxygen's there, if you got blood rouleau, it can't get into, it can't deliver to all the cells, okay? You still have some, free red blood cells, so it's a partial thing. It depends upon what percentage of your blood is actually chained together like that. But when you do blood electrification, it breaks that up, and the blood becomes more, let's say, effective. And you know that has happened within your body when you do a treatment, because you become thirstier. Because there's a ratio between the blood plasma, which is mostly water, and the blood cells, the surface area. When you chain them together like that, you eliminate a lot of the surface area. So if that ratio is correct, surface area to plasma volume, when you break those up, all of a sudden you got all this new surface area, and the ratio is no longer correct, and you're going to feel thirsty. That's one way you know that you just broke up a lot of blood cell clumping. So there's been reports of athletes that have done blood electrification just for the health benefits and to help them in their athletic endeavors. Yeah, here it is, rouleau. It's in Wikipedia. So yeah, So that's my business. I sell different blood electrifiers. That's what I do. So yeah, if you're fighting any health problem, improving the blood will improve your health situation. And then, of course, we just got through a pandemic, and when I got the infection, I did 4 hours of blood electrification, and the only symptom I had was a little bit of fever. But a few days later, I felt it in my lungs, so I started doing electrification across the lung area. But all in all, it reduced the capacity of the disease to really hurt me. I don't have any long-lasting effects from it, and truth be known, I still have low immunity. Which is one reason I still use it 2 or 3 times a week, because I have low immunity. I get sick easily. So I should literally be dead from this last pandemic. And if it's true that these pandemics are being engineered and planned and orchestrated as part of a New World Order plan to reduce the population, it won't surprise me that they've got another one planned to happen very soon. So this is good protection to have. Okay, my friends, thanks for watching. Take care.